What you eat and what you put into your body has a huge impact on your health. When it comes specifically to your gut health, probiotics and fiber become a big part of keeping everything moving the way that it should. Here to talk about that today is Dr. Rohini Vanga with Alamance Gastroenterology. All right, we're going to start when we talk about gut health. What exactly are we referring to when we talk about gut health?
Hi, Tanya. Good evening, everyone. So, gut health is basically, you have a digestive system that is well functioning. It's like a well oiled machine that we need in order to manufacture a quality product. And don't underestimate the digestive system like heart, lungs, and kidneys, which are vital organs. The digestive system is also very important. So, when it comes to gut health, in simple terms, it's about the balanced and diverse gut microbiome, which is a home for billions of bacteria. And it's mostly, bifidobacterium, and that's the common species that we see is Bacteroides. And it's a balance between the good and bad bacteria. So that's the main gut health comprises of.
I love though that you mentioned that we are talking about gut health, but that it impacts all of the organs in the body. So it is important that we pay attention to this. What causes poor gut health? Is it just what you eat?
So there are a lot of things that are very important to maintain healthy gut. Most of all is what we eat. A well balanced diet which contains fruits, vegetables rich in fiber, legumes, whole grains, and also fermented dairy products like yogurt, kefir, and for example, even kombucha. So those are all very important to maintain healthy gut. There are other things that are also play a very important role, and they can lead to poor, gut health is like stress, not having enough sleep, and not having adequate physical activity. And if you're taking unnecessary antibiotics or any other unnecessary medications, these are all the things that can affect gut health.
Okay. All right. So what are the signs that we don't have good gut health? What do we need to be aware of?
So, like, any organ that has symptoms, even poor gut health can lead to symptoms. It can be mild, like you can feel a little queasy in the stomach, or you may feel nauseous, or, after you eat something, you feel something not sitting right in the stomach. Those are all like the early signs of. Early symptoms of poor gut health. You can also have change in the bowel habits. Having regular bowel movements is a sign of good healthy gut. And if you're not having regular bowel movements, if you're having diarrhea or constipation, if you feel gassy, bloated, those are all some of the symptoms for a poor gut, not well functioning gut.
All right, so we know that when we eat something that's not really good for us and we don't feel so good, all right, so that makes sense. But how do we know if it's something more serious than just eating something that didn't agree with us?
So that's a very good question, and it's important to recognize, when to seek medical attention, when to see the doctor, right? So if you have mild symptoms that last for 2 or 3 days, and then your stomach and your gut, get back to normal, then that's good. We know that okay, maybe something that you have eaten, has caused these symptoms. But if these symptoms that I just mentioned are ongoing for 2 weeks or even more than that, and they are getting worse, then you know that something is not right. Something has happened in your gut, and that's when you really need to talk to your doctor and get some advice.
Okay, and so we're going to be talking about that, going to the doctor. We're going to talk about some other things as well after the break. We're going to talk about probiotics and fiber and where we really get that and what's really the good stuff and what's the stuff that we should just leave on the shelf. We're going to be talking about that coming up next.